प्यारे बच्चों, हमें पढ़ना था कि वुंड क्या होता है, इसकी डेफिनेशन क्या है, साइन क्या होती है, क्लासिफिकेशन क्या है, टाइप्स और ट्रीटमेंट। तो सबसे पहले वुंड क्या होता है? A wound is a break or disruption. Wound is a break or disruption in the continuity of the skin. A wound is a break टूटना or disruption, break or disruption in the continuity of the skin, in the continuity of skin. Mucous membrane or tissue caused by physical, chemical or biological factor. Physical, chemical और biological factor. फिजिकल से, केमिकल से या बायोलॉजिकल फैक्टर से. इट मे इन्वॉल्व डैमेज टू अंडरलाइंग टिश्यू. इट मे इन्वॉल्व, इसके वजह से होता है, डैमेज टू अंडरलाइंग टिश्यू एंड ऑर्गन. इट मे इन्वॉल्व डैमेज टू अंडरलाइंग टिश्यू एंड organ depending on the severity. So main sign of a wound. What are the main sign of a wound? 6 sign होता है. Number 1, pain caused by nerve irritation or exposure. Pain caused by nerve irritation or exposure. Second one is bleeding. Severity depend on the depth and size of the wound. Severity depend on the depth and size of the wound. Bleeding. Swelling due to tissue injury. Swelling due to tissue injury and inflammation. Redness indicate inflammation or infection. Redness. Loss of function may occur in severe or deep wound. Loss of function. Discharge clear, bloody or purulent. Depending on the stage of healing or presence of infection. सो क्लासिफिकेशन ऑफ वुंड के लिए, क्लासिफिकेशन जो होता है वुंड का, बेस्ड ऑन काउज, कारण के आधार से, बेस्ड ऑन कंटामिनेशन, बेस्ड ऑन हीलिंग ड्यूरेशन, बेस्ड ऑन डेप्थ. सो बेस्ड ऑन काउज क्या होता है? मैकेनिकल काउज हो सकता है, कट, लेसरेशन, एब्रेजन. मैकेनिकल वुंड. केमिकल में काउज बाय एसिड, अल्कली और टॉक्सिन. थर्मल वुंड, बर्न्स, हॉट, कोल्ड इंजुरी. थर्मल वुंड. रेडिएशन वुंड caused by ionizing or non-ionizing radiation. Surgical wound, result of incision made during surgery. So these are cause. So cause is mechanical, chemical, thermal, radiation, surgical wound. Based on contamination, clean wound, surgically created with minimal contamination. Clean contaminated wound, surgical wound exposed to respiratory, GI or genitourinary tract. Surgical wound. Clean wound is surgically created wound with minimal contamination. Clean contaminated wound is surgical wound exposed to respiratory, GI or genitourinary tract. Contaminated wound, open traumatic wound with visible contamination. Infected wound shows sign of infection. Like pus, fall, odor or necrotic tissue. So based on healing, infected wound shows sign of infection like pus, fall, odor, necrotic tissue. Based on healing duration, acute wound heal within a predictable time frame. heal within a predictable time frame in season average. Chronic wound take prolonged time to heal or recurrent. Diabetic ulcer pressure sore based on depth के आधार पे superficial wound involve only epidermis. Partial thickness wound extend into dermis. Involve only epidermis. Superficial wound partial thickness wound extend into dermis. Full thickness wound involve subcutaneous tissue, muscle or bone. Subcutaneous tissue, muscle or bone. Type of wound is abrasion, superficial scraping of skin. Abrasion is type of wound में abrasion is superficial scraping of skin. Second, laceration is irregular or jagged tear. Irregular or jagged tear. Third is incision, clean straight cut. Puncture wound, deep narrow wound caused by sharp object. Avulsion, skin and tissue torn away. Skin and tissue torn away. Avulsion. Burn is thermal or chemical damage. Contusion, bruise caused by blunt trauma. Ulcer, open sore due to poor circulation or pressure. Open sore due to poor circulation or pressure. Treatment of wound. So first is initial management. So first aid. What is first aid? Stop bleeding using direct pressure and elevation. Clean the wound site with a sterile saline or antiseptic. Protect the wound with a sterile dressing. First aid. Stop bleeding using direct pressure and elevation. Second is clean the wound with a sterile saline or antiseptic. Third is protect the wound with a sterile dressing. Second is definitive treatment, definitive management. Definitive management is superficial wound, clean, apply antiseptic and dress. Superficial wound के लिए clean, apply antiseptic and dress. Suturing for deeper wound, ensure proper approximation. Debridement, removal of necrotic or infected tissue. Antibiotic for contaminated or infected wound. Tetanus prophylaxis if applicable. Chronic or non-healing wound. So it will take long time. So advanced dressing with hydrocolloid or foam. से ड्रेसिंग करना. नेगेटिव प्रेशर वुंड थेरेपी, NPWT, नेगेटिव प्रेशर वुंड थेरेपी. ग्रोथ फैक्टर थेरेपी. सर्जिकल इंटरवेंशन इफ नेसेसरी. स्पेशल वुंड, बर्न, कूल द एरिया. स्पेशल वुंड में बर्न है, कूल द एरिया, कवर विथ स्टेराइल ड्रेसिंग एंड मैनेज फ्लूइड. Pressure ulcer, frequent repositioning, pressure relieving device and wound care. Diabetes ulcer, blood sugar control, offloading, wound management, follow-up, monitor for infection, redness, pus, fever, promote healing through proper nutrition and hydration. So proper wound classification and timely management are crucial to ensuring effective healing and preventing complication.